Welcome to the CodeCast Podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the CodeCast Podcast today. My name is Terry Fletcher. So today I'm going to talk about the No Surprise Act, because under the No Surprises Act, there are all kinds of things that have been popping up lately. I even had something that was kind of personal pop up from something that I had to deal with from a family member, ambulance care in 2023, and all of a sudden I get balance billed, or my person gets balance billed, and I'm just like, what are you talking about? We went back, we gave them the insurance, all that kind of stuff, and they're just like, oh, wait, you know what? We billed it as a courtesy, but now you owe us the $2,600. And we're like, not so fast. So we went back to the insurance company. They said they never have a claim. There's nothing saying they got it. But if they have proof of a claim, they will go back and process it because there was coverage at the time. It's even an insurance that person doesn't have anymore. They changed insurances. So it's kind of a mess. But what's the problem is that you've got these entities that think that they have all the power. And ever since the No Surprises Act was implemented in January 2022 for out-of-network reimbursement and sometimes in-network in certain circumstances, it's really become kind of a complex and resource-heavy challenge for health systems, providers' offices, patients, and hospitals. It's terrible. So I just wanted to talk about that a little bit because what the No Surprises Act, the NSA for short, what it was designed for is to shield patients from unexpected medical bills where they're being balance billed when it should have gone through their insurance and it should have been at a reasonable rate. And if it wasn't, then there should have been something that was called a good faith estimate, or the patient told that you're going to be responsible. Now, you know that ambulance care knows that, well, the patient's in distress. We don't really have to do that. Wrong. This was actually something that was put together and installed because of ambulance care, because they're the ones, and also air care, because those are the entities that have been the worst when it comes to attacking patients and thinking that, they can just charge whatever they want. And so high impact specialties include emergency medicine, radiology, anesthesia, and they're particularly vulnerable because they're usually on rotation. They don't get a choice, or a chance really to get a good faith estimate together to even interact with the patient. They're usually, again, on rotation or part of a system that, enlists them. And so, but the reason I wanted to bring this to the attention today is because since I had to deal with it and I had to go through all the steps and deal with the dispute resolution and all that kind of stuff, it did cost us out of pocket for the person we were assisting about $250, but we didn't end up having to pay it. So they were actually in the wrong. They had to take it out, and we actually got the payer to write a letter to tell them that they missed timely filing. And that actually, so I'm in California, that's actually part of also what California does too, is they have their own No Surprises Act. And that's why I also wanted to bring that to, your attention as podcast listeners, is that there is, a No Surprise Act under the federal level, but then there's also, you need to check what your state level is. And sometimes that's not only more powerful, but it's stronger if you're dealing with an entity that's trying to surprise bill you or a patient or, anybody, and, you have the state behind you. But before I get into any details, first I wanted to say thank you to our sponsor, Advanced Specialty Coding. Don't join them this fall for virtual summits and billing and compliance virtual summit. They say they are can't miss events for those coding orthopedic, anesthesia, and pain management services. CodeCast listeners save 10% with the code VIRTUALS2025 at checkout. You can register now at decisionhealth.com/virtuals. And again, CodeCast listeners save 10% with code VIRTUALS2025 at checkout. Okay, so as we talk about this No Surprise Act, something interesting just, really keeps popping up for me as I research this. And again, I've had to deal with it personally. So I not only know what the HHS is saying about this because it's their data, but also what, you have to do to follow the process. Now, many of you may not have a personal health care attorney or anything like that. But if your practice does, especially if you're dealing with this with patients and not personally, like I had to deal with, you want to enlist their help too, because they can be very helpful just to write a letter to the entity trying to overcharge you, and they can quote the No Surprise Act pretty well. So, according to the American Health Insurance Plans and the Blue Cross Blue Shield Association, over 10 million No Surprise Act eligible claims were processed in the first 9 months of 2023. So there's just so much going on with this. And I want you to just keep in mind some things that you can do to make this go quicker for you, because the IDR process, which is the independent dispute resolution, it's not only a process for the practice or a physician, but it's also a process for the patient. Patients is cheaper. You have $25 initially, and it could go up to $250, but it maxes out there. And physicians, it starts a little bit higher. But basically, you have to understand the key components. There's, advanced explanations of benefits. There's continuity of care provisions. There's all kinds of things that go into the, for example, revenue multiplier to figure out, what is considered a reasonable amount that you're supposed to get paid when there are out-of-network claims, out-of-network providers that are maybe in an in-network facility. And that's what we were dealing with. And I probably should just come clean. It was what I was dealing with. So had a weird thing happen, in June of 2023, ambulance came. It was so stupid. And then I'm dealing with this. So, I hate to put that out on a podcast, but because I know some people are like, oh, let me just tell you everything. I am very private about things that are medical. So anyway, they were dealing with the wrong person, because I wasn't going to let that slide. And it doesn't matter if you can afford it or not, no matter who you are. If you have insurance, even if it's crappy insurance, like what we get here in California, my husband is retirement age, so he's on Medicare Advantage. I'm 10 years younger. I'm not. So we have a difference of insurance. And when you have to go out and get it on your own, you're kind of stuck with, what they call affordable health care, and which is awful. And it's not affordable at all. Right now, my insurance has a $7,000 deductible, a $50 PCP copay, and it's just insane. But at the time, I had COBRA against my husband's insurance he was a former teacher. And so that was still in play. And luckily, that plan, which was an Anthem plan, an EPO actually, they were very helpful to get this resolved. And I was quoting No Surprise Act, because as some of you may or may not know, once you start quoting that and they know what you're talking about, they don't blow you off. Because even though we had, decent insurance when I was covered back then, if you no longer have them, they don't always want to help you. But here's some things you can do for out-of-network claims recovery that'll really help you if you had to deal with what I had to deal with. So I know a lot of you know I'm not big on the AI influence that's coming on because of how many safeguards there aren't, and guardrails or anything. I think it's out of control, and it needs to be reeled in and needs to be regulated. But artificial intelligence can be used to surface, if you are in a practice, underpaid claims subject to NSA regulations. It can enable your revenue cycle team, so your revenue cycle office, your billing office, to focus on, there's probably 20% of claims that drive most of your revenue. And that automation, ensures that high-value claims are promptly flagged for review, and it can improve your recovery rates when you don't have much effort to do that. So make sure you're contacting whoever your software billing practice is for your software. It may be tied to your EMR, may not be, but ask them what their automated claim identification through AI is, because that can really help you. Also, one of the big things is you need to track deadlines with precision. The 30-day negotiation window following the initial payment is critical for successful claim resolution from a practice. So automated tracking systems and alerts can make sure that no opportunity for your reimbursement is missed. So by implementing escalation workflows, not only hospitals use this all the time, but physician practices can make sure that they are not locked into suboptimal payment rates. Also, make sure that your billing staff, and this is something you probably need to have a meeting soon if you haven't already. In revenue cycle management, offices, they used to be called the billing office. So whenever I hear RCM, that's coders, billers, collectors. One thing that I've noticed is everyone tries to use a one-size-fits-all strategy for every payer, but those don't work. You need to analyze payer-specific trends and historical outcomes. You can tailor your negotiation tactics to maximize your recovery of your reimbursements. So, some data has indicated that tailoring strategies can increase your success rate, especially if you have to go to independent dispute resolution, up to 70%. And, because specifically what that payer does and making that a white paper policy. For example, I have a matrix for that pesky little add-on code G2211. And I know what payers pay for it, what payers have stopped paying for it, what Medicare pays for it, what they did last year versus this year, etc. And I have it on a type of spreadsheet matrix thing. If you're a Coding Corner client, you can always ask for a copy of that. Happy to give it to you. But you have to make sure that you're not using a one-size-fits-all strategy when you're working not just on the No Surprise Act, but on collection-specific issues for payers. Also, if you win your, let's say, dispute resolution cases, it's not just about getting paid, but now you've got negotiation and leverage for improving future negotiations. So you can say, okay, by the way, we won our last 2 decisions on our IDR submissions, and you can redact it, but send that to anybody that's dealing with, if you're trying to strengthen an in-network contract negotiation or optimize further reimbursement rates, as contract season's coming around, you can say, we're not messing around. Look at what happens if you try to undercut us. And then also make sure that when you're managing out-of-network claims internally, it requires specialized knowledge and significant resource investment. So you really need to have some kind of model that can assess your volume of out-of-network and what are your available resources. Make sure that you have a good strategy when you're looking at the regulatory environment surrounding the No Surprise Acts, because right now it kind of has a little bit of influx. There's court decisions, there's policy shifts. I know also with the Trump administration, they're adding some layers of complexity, actually very pro-patient. There's some that's pro-physician. Remember, President Trump is a businessman, so he gets both sides of it. And so he's trying not to make it where it just messes up the physician's income. He's making it where it's also advantageous to the physician so that the payers don't undercut them, but that also the patients aren't surprised when they get, like I did, this bill for $2,600 when you thought it was covered by who was your payer coverage at the time. And then you also have to make sure that whoever really looks at either the No Surprise Act or, again, going back to who's in charge of your collection activity for your claims that are out of network, there are so many developments that unfold. There's so many updates. They have to be able to adapt quickly in the changes in the published guidance, the law, and the processes of IDRs and the QPA calculations. Remember, those calculations, what that is that's qualifying payment amounts. So they do a methodology, and it's complicated by the environment and the geographic location you're in, etc. And so you have to recognize that under the NSA, it'll depend less on simple compliance and more on a proactive strategic approach to out-of-network revenue management. So you're in the best position for success if you take advantage of advanced technology to streamline your process and also understand the regulatory complexity. I would also get, maybe even a new lawyer involved, that their prices aren't as high as maybe a seasoned lawyer that's been doing it for a while. I know I have one, Karen George, and she's awesome, and she's out of Los Angeles, and she is very reasonable, but she really studies this stuff, and she works in the No Surprise Act climate every day, in the field every day. And so, you can ask her any questions off the top of her head. Just like for me, for example, you ask me any question about procedural coding for cardiology or for gastroenterology or anything telehealth, anything E&M, I can give it to you without even looking it up. So things like that, that's what kind of person you need to help with that. So make sure that, you really have taken this, taken it to heart, because you're going to have more and more patients as I'm seeing more and more third-party companies come in and try to bill patients and balance bill patients. I know WellCare, remember WellCare is not an insurance company. Either is Optum. They're third-party. They call themselves health administrators, usually for Medicare Advantage, but they're also for United Healthcare, which they have their toes in everything. And they try to undercut. I just recently found Optum saying that there was a denial for an NCCI edit, which none existed. I looked everywhere. I'm like, there's no edit there. I saw WellCare trying to deny for a injection under ultrasound guidance, a large joint injection, saying that it was an add-on code, 20611. No, it isn't. And then trying to say that you needed some other kind of numbers for the medication, which it was already on the claim. So those kinds of things you have to know, which brings me again back to my point of making sure that you don't just try to do a one size fits all. When you are dealing not just with collections, but anything out of network, anything that has to deal with or do with No Surprises Act, you need to make sure that you have it all laid out. You go back and look at what the No Surprises Act is. I even have and it's older, but it's still current, on-demand webinar for that. And, just Google and find out what you can find out there, and make sure that you have that in white paper in your practice, how it relates to your practice. And if you have any outcomes, if you've had to take any payers to task and go through the IDR process, make sure you have your outcome in that folder or in that chart, in that, I hate to call it in that notebook, but I'm old school. I like to have things on paper just because I may have to go back and look at that. I mean, I sit at my desk with my spiral bound professional edition CPT book to my left every day. I'm in it every day. That's why my spiral bound pages are always frayed. But, it's nice to also integrate AI, integrate a lot of technology-driven strategies, but you also need the white paper for proof. You do. Otherwise, you're just going to have a problem. And like I said, in my situation where I had to deal with the ambulance and then find out that they, didn't file a claim, they didn't have a copy. I was also dealing with, an outsourced out of country, I think it was India, collection service, or not a collection service, whoever was dealing with their collections at that company, and then, trying to say something that was not true, so they didn't understand U.S. stuff. And I was able to get them to stop and, desist, and also find that, that's their responsibility for the, not filing timely claims, even saying, oh, we did it as courtesy. No. You are out of network for an in-network facility. If you don't want to deal with the in-network facility, then you shouldn't have been taking people there or answering the call. And so, and I know this sounds a little braggatory. I'm not trying to be bragging, but I have perfect credit. My credit score is 850. I have perfect credit, and I will not let anyone ever do that. I paid off my mortgage. I always pay off my credit cards. I know not everybody can do that, but I've made it my life's mission, and I'm constantly on my daughter to do the same. She's an adult and she's a spender, but she gets it because she was able to buy a house at 27 years old, right before she got married. So it's so important to me to maintain my, my perfect credit, and I will not let that, be hindered by medical bills that I do not owe. And I hope you would also protect your patients on that front as well, by just making sure you're familiar, get updated, and understand how the NSA works. Okay, so I will get off my soapbox for that. I know that was probably a little much, but when I do the CodeCast and I talk about these things, especially when I get into something that I can relate to, something I've had to deal with. It makes me very, very passionate and very, matter of fact and business-like when it comes to what you really need to do to make it work for your practice. And it is really on you to make sure that your due diligence is in writing, you're on top of it, and you make it your mission to make sure that you're there for not only your practice, but your patients, and you never know when you may have to deal with it yourself, especially as we all get older. Okay, everyone. Well, that's it for me this week. I hope everyone has a good week. So make it a great day, and thank you for listening to the CodeCast Podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.